The armamentarium to deliver the TAP 3 includes the following: a George gauge, thermocryl or blue mousse paste for the bite registration, cold cure acrylic, petroleum jelly, a cup of hot water for the thermocryl, a cup of warm water to cure the acrylic, Instacool, which is optional but will set the thermocryl faster, various burrs and polishing wheels, scissors, and the tap and tap accessories. Taking the bite registration. Before a tap can be prescribed for a patient, the dentist must take a bite registration to send to the laboratory with a patient's stone models. Fit the George gauge in the patient's mouth with the handle at the midline. Have the patient move their teeth to an end-to-end position. The gauge will read 0. This is the neutral position. Have the patient protrude their jaw forward and measure. Then, have the patient retrude their jaw and measure. In this case, the patient ranges from +7 millimeters to -3 millimeters. You can take a bite registration with 2 materials, thermocryl or blue mousse paste. Heat a small amount of thermocryl pellets in a heat-resistant cup until it becomes clear and soft. Place the thermocryl on the bite fork. Set the George gauge. In this case, it is 50% of the patient's maximum protrusion. Place it in the patient's mouth. Orient the bite fork along the midline with the handle parallel to the occlusal plane and directly forward. Remove the George gauge and cool the thermocryl with Instacool or place it in a cup of cool water. Once cool, place it back in the patient's mouth and have the patient bite into the bite registration. Check for the fit of the bite and the location of the handle. Be sure it is parallel to the occlusal plane. Reheat the thermocryl and repeat the process if necessary. The second bite registration technique is to use blue mousse registration paste. Use the George gauge at the same predetermined protrusion, 50% of maximum protrusion. Squeeze the mousse paste onto the bite fork. Place it in the patient's mouth and fill in the gaps between the teeth with the mousse paste. Remove the bite fork from the patient's mouth and remove the fork from the George gauge. Place the bite registration back in the patient's mouth to check for fit. Start the process over if you did not achieve a quality bite. Fitting the TAP TL. The following technique should be used to fit the TAP 3 triple laminate. Have the patient place the upper tray in their mouth. Check for fit, comfort, and retention. In this instance, on the upper tray, there is a particular tooth that is uncomfortable. Use a thin, straight acrylic burr. Carefully remove a small amount of the lining from the area of the tray with too much retention. Be conservative with your adjustments. They should be very slight. Any over-adjustment may affect the retention of the trays. Fit the tray in the patient's mouth with each adjustment to avoid over-adjustment. Have the patient remove the upper tray from their mouth. They should remove the tray by starting from one side on the posterior and pulling down. Have the patient place the lower tray in their mouth. Check for fit, comfort, and retention. To remove the tray, have the patient push up on the posterior of one side of the tray with their thumbs. In this instance, on the lower tray, the appliance is too tight on the right buccal. To adjust retention, reduce the height of the flanges covering the teeth. Do not adjust the lining of the tray. Adjustments should be very slight. Fit the tray in the patient's mouth with each adjustment to avoid over-adjustment. Fitting the TAP thermocryl. The TAP 3 with a thermocryl liner is used for certain situations. If the patient has short teeth, has no undercuts, or is planning for future dentistry, the thermocryl can accommodate them. It is a unique thermoplastic polymer that softens and turns clear in hot water at approximately 160 degrees. It can be reheated and refit, and the trays can be relined if necessary. To fit the TAP thermocryl, heat one tray in hot water until the thermocryl turns clear and becomes soft. Do not use water hotter than 160 degrees, or leave the tray in hot water after the material turns clear. This may cause the tray to warp. Once the material turns clear, remove the tray from the water. Place the tray in the patient's mouth immediately. Press down with even pressure, especially in the posterior. Do not rock the appliance over the teeth. Some thermocryl will express out of the tray. Remove the upper tray by the hard outer shell. Do not touch the soft lining material. It may distort. Observe the excess material. While the thermocryl is soft, trim away all material beyond the edge of the hard shell with curved scissors. Use the edge of the tray as a guide. Make certain there is no material on the gingival. Smooth the edge of the tray with a wet finger. Repeat this process as necessary. Cool with Insta-Cool spray, or place in cool water to set the thermocryl. The thermocryl will turn white and become hard. Have the patient place the tray back into the mouth. Check for fit, comfort, and retention. The thermocryl will continue to set for 15 minutes and shrink slightly, which will increase the retention. Once the tray is seated and comfortable for the patient, polish the flanges with a fiber wheel to remove excess thermocryl. Repeat the fitting process for the lower tray. Once you finish fitting the trays, have the patient place both trays in their mouth. Make sure the trays fit properly. Also, make sure the hardware is in the correct position, can hook together, and function properly. Relining the TAP thermocryl. It may be necessary to reline the TAP thermocryl if the patient had any dental work or if the liner has deteriorated over time. Usually, the TAP thermocryl should be relined yearly to ensure its integrity. In this example, the lower tray will be relined. Heat and remove the old thermocryl from the tray using a spatula. The thermocryl is ready to be removed from the tray when it turns clear and soft. Be sure not to use water hotter than 160 degrees or leave the tray in the water too long. This may warp the tray. Place the thermocryl beads in hot water and heat until the beads coagulate and become clear. Wet your fingers and roll the thermocryl into a rope. Fill the tray completely to the top with the thermocryl. Have the patient place the tray in their mouth and press it into place. Then, have the patient remove it. Trim any excess thermocryl that expressed out of the tray as explained in the Fitting the Tap Thermocryl segment. Have the patient place the tray in their mouth again and place cotton rolls on either side of the tray to help seat it. Again, have the patient remove the tray. Trim any excess thermocryl and repeat the fitting process if necessary. Once the tray is relined and fitted, place both trays in the patient's mouth. Check for fit, comfort, and retention. Setting the initial treatment position. Have the patient place the upper and lower trays in their mouth. Train the patient to hook the trays together and unhook them. You may have to guide them until they become accustomed to hooking the trays together. Be sure to warn the patient not to bite down on the hook or socket, which could damage the hardware. Another way for the patient to place the device in the mouth is to hook the appliances together outside the mouth, and then place the conjoined trays in the mouth. Once the trays are in the mouth and hooked together, dial the patient forward to the patient's maximum comfortable position. Have the patient indicate when this point is reached. By taking the patient to their maximum comfortable position, you will know their range of protrusion. From the maximum position, dial the hook back and count the turns. Start the hook in the most retruded or back position. The hook will be all the way back against the posterior of the spindle and base plate. Have the patient turn the adjustment key a half turn forward or 180 degrees per night towards their left shoulder until symptoms are relieved. If any position becomes uncomfortable, instruct the patient to dial the hook back or towards their right shoulder until they are comfortable again. If the patient is still experiencing discomfort, have them make an appointment with you for an assessment of their tap. If the patient needs more protrusion, the hook can be placed in two positions. The first position is in the slot of the socket. The second position is behind the slot of the socket, which gives the patient 6 more millimeters of protrusion. After the hook is set, the next step is to clear any posterior interferences. If there is any posterior interference, such as imbalance in the trays, or if one side is higher than the other, it could cause TMJ problems. Mark each side of the tray with ribbon. Using a burr, remove contacts indicated by the ribbon. Repeat this process until all contacts are removed. Once any posterior interference is removed, check for clearance on both sides of the trays. Any adjustment protrusively will further open the posterior. If you want to prevent the patient from disengaging the trays while in the mouth, the notch in the socket on the lower tray can be filled with acrylic. Mix cold cure acrylic. Place the acrylic in the slot and under the lower plate. Hook the trays together and slide the hook from side to side to clear the slot. Be sure not to clear any of the acrylic from the notch. Turn the upper tray 90 degrees in relation to the lower tray to disengage the hook. Again, leave the notch filled with acrylic. Cure the lower tray in hot water. Once the acrylic is set, trim and smooth the acrylic, and then polish it. Place the trays together by turning the upper tray 90 degrees in relation to the lower tray. Have the patient place the trays in their mouth. Make sure the acrylic is smooth to the tongue and the trays fit together properly. Posterior support. Posterior stops can be added at any time to support the temporomandibular joint. It is extremely important that there is a space bilaterally between the trays prior to adding the acrylic posterior stops. The objective is to create bilateral, even posterior stops at the patient's treatment position. Since the relationship of the maxilla and the mandible changes with the changes in protrusion, this procedure must be repeated if the treatment position changes. First, lubricate the posterior of the upper tray with petroleum jelly. This will prevent the tray from sticking to the acrylic when adding acrylic posterior stops. Add cold cure acrylic to the molar area of the lower tray. Have the patient place the tray in their mouth and hook the trays together. Have the patient slide their jaw side to side. This will flatten the posterior stops into place. Have the patient remove the lower tray from their mouth. Place the lower tray in hot water to cure the acrylic stops. Trim, smooth, and polish the posterior stops once they fit properly. Have the patient place the lower tray back in their mouth and hook the trays together. Check the posterior stops for fit and function. Make any adjustments necessary. When the tap is in the patient's mouth, the final vertical opening is kept to a minimum of 6 millimeters. This allows lip competence, which improves the patient's comfort. Exercise bite tabs. When the lower jaw is pulled forward during the night, it may make the jaw muscles sore and temporarily changes the bite. The exercise bite tabs are intended for the patient to use each morning as an exercise tool to put the jaw back into normal bite position. Take both tabs provided with the patient's case. Place one tab between each canine tooth. Instruct the patient to move their lower jaw back and forth. When the patient's jaw is in the back position, have the patient squeeze as if to put the back teeth together. Repeat the exercise with the tab between the central incisors. Remove the exercise bite tabs to see if the teeth come together. Repeat the process until the jaw is back in normal bite position. This is an example of what to give the patient after delivering either the TAP TL or TAP Thermocryl. Send them home with a TAP appliance, the TAP storage case, the exercise bite tabs, and the patient instruction booklet.